Good afternoon, ladies and gentlemen. Welcome to the Adults Health and Housing Cabinet Member Briefing for Wednesday, the 8th of December. Do we have any apologies, Karen?
There are none.
And late items to be introduced by the Chair, there are none. And declarations of interest, there are none. So can we then go through the minutes of the meeting held on the 23rd of June? And can I accept those as a true record? I think I can, having read through them several times. And then we come to item 5, which is the CareLink charging policy and digital switchover. So over to you, Kirsty.
Thank you, Chair. So a reasonably short report here with a couple of recommendations, and just by way of background then, so CareLink is the Council's alarm service whereby individuals can choose to have a service by paying a weekly charge, and we will monitor their, I suppose, well, it's not monitoring them. It's a service whereby if they have a particular risk, or if they fall or they need some assistance, they can communicate with us through telephony, and we monitor those arrangements. And actually, on occasion, we will go out and visit people if they're in an urgent need, or we liaise with their friends and family. So it's a fairly well-established service, but it absolutely requires on telephony. And so this paper is addressing the fact that there's going to be most people are already familiar with, the digital telephone switchover, which has already started in various parts of the country. And by 2025, our old analogue network will be switched off, and across the UK, we will have a digital telephony system. Unfortunately, what this means for CareLink is that the existing equipment that we use that is currently relying on the analogue will need to be upgraded so that that the service can continue into the future, because otherwise, the service will not be able to be maintained, because that analogue network will no longer be supported. So the report is asking for 2 recommendations. The first one relates to how we're going to fund the actual equipment, the capital purchase of the equipment, which is a combination of our normal arrangements that we have for replacements and renewals, but because we will need a large amount of equipment over the next couple of years, we do have some provisions in the Council's capital programme. But the actual recommendation we want consideration of is in relation to increasing the ongoing weekly fee that we charge to individuals, so that it can cover the new costs associated with the digital equipment. And I'll just talk you through what those cost increases are comprised of, and it's under section 4.5 of the report, whereby the new telephony that we'll need to be using could do with a technical person really, but it relies on a GSM connection, which is a global system for mobile communication standard. And in order to do that, the technology uses a SIM card, and a SIM card we can all relate to if we have a mobile phone. So it's that piece of technology that the digital switchover requires us to put in place. So we've got the cost of the new actual equipment, the GSM equipment, that we will pay for, like I've said, out of the Council's capital programme, but it's the ongoing revenue costs which are around the SIM card, and also we've got a bit of admin and installation that we'll need to do, that we do need to pass on to our customers. There just isn't sufficient income from the charges to actually pay for that ourselves within CareLink. So the current cost of the service is £4.90 a week. And once we add in the monthly cost of the SIM card, plus some additional administration to do with the replacement and maintenance and the installation of the new equipment, the proposal is that the new fee would be £6.25 per week. And obviously that is over and above an inflationary uplift, but it is very much to deal with this digital switchover. Normally we would inflate the fee in line with inflation, but actually this is something that's over and above that. One of the things to note is that it's not feasible for customers to ask to provide their own SIM card, if they think they can get a better deal. And that is really about the fact that we need to be absolutely assured that that SIM card is live and operational, because otherwise we could have a scenario where someone contacts us, but if we cannot guarantee the connectivity to our equipment, then we may not get the call. So that's a sort of risk to the individual. That's why we want to be the ones providing the SIM cards. And in terms of other options, we can't continue to we haven't got the funds through, because the service is entirely funded by income, to just upgrade all of the SIM cards. We will literally not have enough income, and the service would very quickly be unsustainable. And another approach, which hasn't been recommended but may be a consideration, is that CareLink, you don't have to have an assessed need, you don't have to have an eligibility to have CareLink, but it is something that prevents people from unnecessarily needing more intensive interventions, because it's a peace of mind, and also we do go out in an emergency. So the council could consider whether it could subsidise this cost so that it wouldn't put people off in the future. It isn't being recommended at the moment because of the council's overall financial position, but if there were opportunities for that in the future, that would be something, if the council was able to consider, that probably would be something to pursue as a preventative sort of measure to keep people, particularly very older people, keep them living independently as much as possible. What we're also proposing, I should have pointed out, is that we will only introduce the new charge if it's agreed at the point at which the digital upgrade will take place. So we're not talking about introducing it as a blanket. It would happen at the point at which. So for some people that might not happen for another 18 months or 2 years, because we've got a rolling programme. And we have had some people who have asked for CareLink now, and obviously we cannot put the old outdated technology in. We've had to already put in the digital technology. So for those people, we have been charging a higher fee than our standard fee, really because we would have had to have denied them access to the service in the meanwhile without having a mechanism. And people have not complained about the costs. I suppose if you're a new customer, you haven't got a benchmark. So this is really about existing customers and being able to apply the new charge at the point of needing to upgrade their equipment. Of course, they may decide not to take that forward, and at that point we would have to negotiate or talk to them really about removing the service. I think we would want to make sure, particularly for the more vulnerable people, as in the sort of maybe older people, that actually the benefits of CareLink, that they need to think through the implications if they withdraw the service, because it's almost a safety net, and sometimes you don't miss what you've got until it's not there. So we would handle that as sensitively as possible. So I think that's probably everything I wanted to draw to your attention. So like I said, 2 recommendations. One is just noting how the replacements are actually being funded, which is some of CareLink's ordinary budget it puts aside for equipment, but then we've also got this injection from the capital programme. And then secondly, it's about agreeing to increase the fees to cover the costs of the new arrangements.
Thank you, Kirsty. Very good explanation. So we're talking about changing from copper wire on the telephone to new fibre broadband standard, which brings its own advantages because it can improve the service that we will be able to provide to our customers. There are some people, some elderly people, some people that may not understand the changeover and the need for it, and I presume that we will be talking through that, as you've suggested, with any customers to ensure that they get the best service possible.
Yes, and we'll probably work with BT as well, because they'll have a programme about informing vulnerable people as well, because obviously they need to get into the properties to do this. So yes, we'll definitely make sure, as best as we can, we keep it simple for people.
And the other thing is that people will not need to have their own broadband connection. This will purely be a SIM card on a telephony system when it is installed.
Yeah, that's right. They don't need to have access to the internet, because the digital telephony line will be that connection for them.
Okay, thank you. Having looked at this and taken care to see what other options are available, I presume we've looked at the cost of the SIM card and got the best deal possible for that.
Yeah, that was definitely explored. I think buying them in bulk has helped us keep the cost down.
Okay, and the other thing, I note that we've had an adult social care bill that we know that there is going to be some funding for digitisation. So could this be looked at again if we get confirmation of any digital technology funding, so that we can get the best deal for our customers?
Yes, and certainly that white paper you referred to wasn't officially announced before this report was submitted for the meeting today. So yes, you're right. Within that announcement, the government has indicated, I think there's going to be 300 or 400 million available for telephony and technology-enabled care. So once we get the details of that, if there is an opportunity to draw down some of those funds to either enhance what we've got or subsidise it in some way, we'd definitely bring that back for a further consideration.
Okay, I can confirm it's 300 million because I've just been on a call this morning with the East and West Midlands adult social care and ICS chairs regarding the white paper and some of the implications in it. So can I make a recommendation then, a further recommendation, that the council should consider whether it can subsidise or withdraw the fee increase required for CareLink once details of the proposed adult social care bill are known in relation to funding that may become available to help digitise the delivery of social care. If this is a possibility, a further report should be brought with appropriate recommendations in due course. So can I then move recommendations 2.1, 2.2 as printed, and to add 2.3, which I have just read out?
Yep, happy with that, thank you.
Okay, in that case, can I thank you very much, and we'll see you in the near future, hopefully when the adult social care bill becomes law.